Western North Carolina is full of beautiful places and great people. It's also a great place to learn and to practice dentistry. If you plan to practice in a small mountain town when you graduate, or provide care for underserved Carolinians in some other way, becoming an AROWS Rural Oral Health and Wellness Scholar can give you the extra tools you'll need to succeed. The AROWS Rural Oral Health and Wellness Scholars Program is also called the AROWS Scholars Program or the AROWS Program. The AROWS Program is a supplemental track of the UNC curriculum, not a separate track. As an AROWS Scholar, you still experience the ACT Curriculum's D3 and D4 gap curriculum courses, and you also get extra experiences and education specifically around the ins and outs of caring for rural and underserved North Carolinians. We're looking for that student who wants to be the dentist who can do the biopsy on the retired gentleman who is unable to drive to a specialist, or tackle that tricky surgical extraction on a young mom whose car won't make it to the next big city to go to an oral surgeon. If you want to be a safety net provider for your patients when you graduate, the AROWS Scholars Program might be for you. The Adams School of Dentistry AROWS Scholars, along with scholars from UNC Schools of Medicine, Public Health, and Pharmacy, form the UNC-CH Healthcare Satellite Campus. The AROWS Scholars make up about 10% of the UNC-CH healthcare students, so the AROWS Scholars have lots of UNC company. MAHEC is the Mountain Area Health Education Center. MAHEC provides education and health care for Western North Carolina and is headquartered in Asheville.
It has absolutely exceeded my expectations. Clinically, I have grown so much over the past few months.
The AROWS program lasts 2 years and has 3 parts. The first part is an evening events series. These are 75-minute learning sessions that occur every few weeks via Zoom throughout your D3 and D4 years. During these sessions, you learn about things such as rural practice, loan repayment, caring for special populations, and how to communicate better with your patients. There are also extra IPE sessions hosted from the Asheville UNC-CH campus that include the UNC-CH Scholars. AROWS Scholars may claim individualization credits for all of these sessions.
The evening sessions are always really neat. It's, sometimes from a practitioner that's been out in practice for many, many years, or a specialist from a different field, whether it be medicine or pharmacy, to just get us a different perspective.
The second part of the AROWS program is AIM Week. AIM stands for Arrows in the Mountains. AIM Week is an externship where the AROWS first come to the mountains and get immersed in public health and rural health. They interact with mountain communities and talk with folks in rural health, and also conduct and present a community analysis. This week is mainly about rural health and just a little about dentistry.
During the externship, all of the scholars will do what's called a community analysis. They will go out to rural communities that they'll also be serving when they're here at MAHEC for their clinical rotations, and they will learn all about that community. It'll also give the students a good understanding of what it's like to actually be immersed in that community. What shops are available? Who are the small business owners? Who might they partner with to promote their own private practice one day?
The third part of the AROWS program is the AROWS Scholar Clinical Care Semester Externship. Each AROWS Scholar will spend a D4 semester at the 2 MAHEC clinic sites in Asheville and in Columbus. During this semester, they are learning clinical care much as they do in Chapel Hill, but at a faster pace. They share clinical space and staff, including dental assistants, with the MAHEC faculty and the MAHEC GBR residents. All faculty at MAHEC are UNC Adams faculty. AROWS participate in huddles, are graded with ACE forms, and follow the 6-week block schedule format just as they do in Chapel Hill.
We have a comprehensive care approach where we treat the patient not only from the oral health but also from the overall health. You get to interact with a lot of residents, with a lot of people with different backgrounds. We always try to have that collegiality environment.
Didactic experiences important to your dental school experience are still going on while you are at MAHEC, so you still participate in your Adams curriculum courses and events such as Bell Leadership, even though you are not in Chapel Hill. Usually AROWS will attend via Zoom, but since some things are just best experienced in person, some travel back and forth for in-person school events is also part of your semester experience. The MAHEC facilities are state-of-the-art, and some of the operatories even have views of the mountains. So who might benefit from the AROWS program? If you want to be in a practice area that is rural or has few dentists, or if you want to treat people who have limited access to dental care, the AROWS program may be for you. If you want to get more experiences and learn a wider range of skills so that your patients won't need to be referred to specialists often, or if you plan to practice for a while in an area where getting to a specialist is not easy to do, this program gives you more awareness of the needs and challenges underserved people face and helps you be more prepared to care for those patients. If you have significant student loan debt, practicing in an underserved area, even for just a few years, can be a smart financial decision. Repayment opportunities are much more available when you serve an underserved region, even if it's not your long-term plan, and the AROWS program can help you navigate those opportunities.
The ideal applicant is someone that wants to push the boundaries to really grow themselves and get outside the school environment where they can really think on their own.
10% of each Adams School of Dentistry class may become AROWS. Currently, that's a maximum of 8 students per year. Recruitment starts fall of D3 year. North Carolina's countrysides and small towns are great places to visit and to practice. If you see yourself practicing in a setting like this, the AROWS program can be a great start.